What's up, you guys? I'm Dr. Nick. This is our third podcast. I have Dr. Mark Weidenbecher with us today, and we're getting into our videos now where we're talking to other physicians and surgeons. And this is great because Dr. Mark has a lot of energy. And what's exciting about this is he's an ENT, and a lot of the things that he does and some of the questions he'll answer today are very relevant to everyone's life, most people's everyday life. So why don't you tell us a little about what you do, Mark?
Yeah, thanks very much for having me here today. So I'm an ENT surgeon, have been in business for probably around 20 years or so. Trained actually over in Germany, did a residency there, came here for some research and ended up staying. Worked in Cleveland for about 10, 12 years at one of the universities first, and then at Metro Health, and then ultimately decided to go into private practice and have had a focus on airway, on voice and swallowing, and lately also on sleep apnea. But I deal with daily things as well. So
you trained in Germany. I did not know that.
Yeah, I trained in Germany, and my dad is actually an ENT. And I just learned the ENT world very early on, and really enjoyed it. And
so can you tell our listeners what an ENT is? A lot of them probably don't know what actually an ENT, what it stands for and what they are.
Right. So ENT, or in medical terms, otolaryngologist, means ears, nose, and throat doctor. So we deal with everything from hearing to ear infections to throat infection, nasal issues, nasal breathing difficulties, allergies, swallowing difficulties, voice problems, and so forth.
All right, I'm going to get right into our questions that everyone always asks. Do I have strep throat? So how do we know, even my wife and kids, Jane has a sore throat. What do we do? Do we get her tested? Do we put her on an antibiotic? Like, how do you know, or what pathway do you take?
Right. So a sore throat is pretty common, right? We all have our sore throats. And the good news is not every sore throat is a strep throat. There are viral infections that could cause it. There's different bacterial infections that can cause it. And the strep throat is actually the Streptococcus pyogenes A variant. And that is actually not as common as we think. It's mostly seen in the pediatric patients. And most of the time, actually, it's not strep, but it can be.
So when my wife, she's a teacher, and she comes home and says, strep's going around at school, is it really going around? Or?
Well, it could be, right? Because I think people know that a strep throat shouldn't be taken lightly, and they end up seeing their pediatrician. Mostly, most of the kids, obviously, it's mostly kids that are involved or have it, and they get strep tested. And if one kid has it, it just gets passed on pretty quickly. And so that's where we hear that strep throats are going around in schools.
So I make the comparison to what we're doing in the foot world. If we have a foot infection and if it's a staph infection, I guess I'm not thinking I'm worried about catching staph. So how does it get from one throat to the other throat?
Yeah, so when we talk, the bacterial, the saliva particles, they travel actually around 6 feet or further when you talk, and that's how we acquire it.
Is that where the 6 foot thing came in with COVID?
Yes, yeah, and then when you sneeze, it could travel up to 25 feet, so it's a lot further. And viruses travel a little further than bacteria, but that's obviously where it happens. And then you touch your nose, your mouth, and then you touch a surface, and then the next person comes around, and then that's how you get sick.
So what do we tell our listeners when they say, when should I get a strep test? At what point do we think you need to go to a doctor?
Right. So I would say if you have a really bad sore throat, if you look in the mirror and your throat and your tonsils are inflamed and red, and if you have had some friends, kids, etc., that have been tested positive, you should absolutely be worried about it. You should also be worried about it if you have kidney problems or heart problems, because that's what our concern is. There can be these reactions that can start attacking the heart valves, and that can cause some heart problems. So that's where we have to take it a bit more serious.
That's all good advice. So you brought up severe sore throats. What about hand, foot, and mouth? I know that gets talked about again in the schools.
Yeah.
What is hand, foot, mouth?
Well, it's a virus that gets again passed on easily, and it's actually something that gives the kids a disease on the like the name suggests, feet, mouth, and hands, and it's something that's very contagious. And
Adults as well, or just kids?
mostly kids, but adults can be affected as well.
Do they get the same symptoms and the same? Does it present in the same manner?
They can, but kids typically get more symptoms.
So, ear, nose, and throat. We're talking about some simple things. What about some of the more complex issues you get into? Like, I know you have a new technique that you're doing for snoring. Can you talk to us a little bit about that?
Yeah, so snoring is a very interesting topic, I think, just because so many Americans are affected not only by snoring, but also by sleep apnea. And snoring, I would describe more as a cosmetic issue. When I see patients in my practice, it's not that the patient came in because he snored, it's because of the wife sent him in, or the other way around. And so it's more an issue that disrupts the bed partner than anything else. The concern, however, is that snoring oftentimes goes along with sleep apnea, where the throat closes and people can't breathe well at night. And that becomes a real medical concern because it starts putting strain on your heart and can ultimately lead to bad things like heart attack and strokes. And so that's where we take it really seriously. So it's estimated that around 20% or so of Americans have sleep apnea, and there's probably a larger number that has just not been diagnosed.
So is it related to body habitus? Like, are obese people more likely to snore?
It can, and it oftentimes is. So one easy thing I look at is how large is your neck circumference. If it's 16.5 inches in guys, you should be concerned. If your BMI is more than 26, 27, you should be concerned that you have obstructive sleep apnea. And obstructive sleep apnea may be present even though you don't have any symptoms. So that's also something to keep, to be aware of.
So what do you do for these people? At what point do they need surgery? At what point can you manage it with, I guess, exercises or other devices like a machine that you breathe with at night, a CPAP machine?
Yeah, right. So the first thing is we need to test people. There's great new devices out there. We still use the sleep lab, but nowadays there's things, little rings you can wear around your finger. And people take those home and test them.
So instead of going to a sleep lab, you can wear something on your finger?
Yes, yeah, you can wear something on your finger. It connects with your iPhone or your Android.
What about your watch? Can an Apple Watch?
Yeah, so there's a few commercially available devices that are not as good, sensitive. There's things you can put under your mattress. There's things like the iWatch that you could use, but they're not as good, so I wouldn't trust those, to be honest. I think it needs to really be an FDA-approved device, a medical device, to make a real good diagnosis. Yeah, and then if you are diagnosed with apnea, there's numerous options out there. The old thinking that everyone gets put on CPAP it really doesn't apply anymore, even though that is what people are concerned about.
Because I have some friends that said it was game-changing for them. They hate sleeping with the machine, but they get a better night's sleep. Their spouse isn't as concerned.
Right. And so you just get through, the natural sleep phases, the deep sleep, the REM, the non-REM, the sleep that really recovers you, so you feel better. The problem is that some patients cannot wear that mask because of claustrophobia, because of other things. And so back in the days, people were stuck. They didn't have any options, and nowadays we have many other options available. We have significantly evolved over the last few years. There are new surgeries out there, new devices, non-surgical options. I think, again, everyone who has apnea, who can use CPAP, shouldn't stop looking. There's great options out there.
So I don't know if I have apnea, but I know I snore, and I actually brought this device with me today to show you. Which I can, but it's a mouth guard that I sleep in, and I bought it on Amazon, of course, and you form it to your teeth with your jaw, your lower jaw thrusted forward, and it's supposed to improve opening your airway, just like if we were intubating someone.
Right.
And my wife claims it works. Like, she always nods me, you don't have your mouthpiece in, put it in, you won't snore. And I don't snore when it's in.
Right.
Do you recommend that, or are those?
No, that's real. So we use those devices not infrequently. In a well-chosen patient, it can be a great option, and it can be a great alternative to CPAP. And essentially, the way these work is it's a boxer guard, one guard on the upper teeth, one on the lower, and connected with a metal rod. And then you can change the screw. There's a set screw, and then it pushes your jaw slowly forward. And because
Mine's not that sophisticated.
Yeah, but that's how they're supposed to look. And then the tongue is attached to the front of the chin. And as you move your chin with the mouth guard forward, it pulls the tongue and the palate forward, which is where the thing in the back dangles. And that makes you stop snoring and makes you breathe better because it opens up your breathing hole.
So Spire, right? That's the surgery that you...
Inspire.
When do you need that? At what point do you have to go beyond these devices?
In some of the patients, the apnea is so severe and the collapse, the obstruction is so severe that we need a bit more of a sophisticated device. And one of the devices that I implant very frequently, that is very popular, is the Inspire device. So it's essentially a pacemaker-like device that we install surgically, and the device gets turned on with a click of a button. There's a remote control that you just leave on your nightstand. And then it monitors your breathing, and it gives the tongue a bit of a tone. It prevents it from slipping down in your throat and causing blockage. And it does this all night long until you turn it off, and that's how it keeps your throat open. And it's very effective. It's almost a minimally invasive surgery, outpatient for many for many patients.
And patients are responding very well to this?
Very well. At least 3 out of 4, but maybe even more patients are ultimately cured from their apnea. And the satisfaction rates are north of 90% for patients.
Excellent. You brought up the punching bag, the uvula. What's it for? Everyone always asks me, you're a physician, even though I'm a podiatrist, you're a physician with a medical school. What's that thing in the back of your throat?
Yeah, really, there's no function to it. Believe it or not. However, when we cut it off, which we do for some patients, they're...
Cut it off? Why would you cut it?
Because they're like you, they snore. And the wife says, you got to stop snoring.
Julie, I'm not cutting my uvula off. I'm sorry. no elective surgeries for that.
Yeah. So there's really not a function for the uvula, but we know that some patients where we cut them off, their taste is a little bit altered. So I would say in some patients, they have a little bit of a taste function.
So my dad was hospitalized twice when I was a kid for it swelling up. And he was losing his airway, I guess. And one time we think it was due to chicken feathers or something. He was hunting and he had chickens, and it happened that night. And I forget the second time, but it happened to him twice. Is that common? Do you see that?
So I'm not sure about the details, but we see the punching bag swelling up if people snore because it flutters and hits the throat so often, so it just swells.
Well, he was a big snorer. Maybe that's what was happening.
But what may have happened with your dad is also we have things like anaphylactic reactions that can swell the tongue, the palate, the punching bag, lips, and the vocal cords. So it becomes a real concern, a medical emergency at times. And so he may have had that, and that can be serious.
Interesting. Well, let's talk about the nose. What do you do with the nose? Anything interesting?
Oh my God, I see so many patients who see me for nasal problems. Some for cosmetic issues, but the majority of patients who see me are bothered by breathing difficulties.
Like a deviated septum?
It could be a deviated septum, but what they're complaining about is that they can't sleep well. Again, it goes back to the snoring, and they breathe through their mouth, and then in the morning they have cotton mouth, and that will actually further promote sleep apnea. So it's really important for sleep health to be able to breathe through the nose. Believe it or not, the nose is our humidifier. The air travels through the nose and gets humidified. By the time it's in the back of your throat, it's 100%.
Interesting.
Whereas when you breathe through the mouth, it hits the back of your throat. It's 40-50% humidity, and it dries it out, and it makes your spit really gooey and thick. It bothers people a lot.
So when people have nosebleeds, because this is a question that I think a lot of our viewers are going to be asking, if they have a nosebleed, at what point do they need to have that vessel cauterized, or when do they need to see you to get a cauterization, or what's causing these nosebleeds?
The most common nosebleed arises from the front of the nose. Often people have high blood pressure or on blood thinners. And then we see it oftentimes in the younger
my
population.
daughter had this problem.
So either they pick their nose, or they just have larger vessels there. And if it happens a few times, I think we can let that slide. But if people or kids have bleeding once a week for several months, I think they should come in and should get it cauterized. Mm-hmm. It's very easily done in the office.
It's done in the office?
It's no problem. We numb the nose up, and then there's a stick that contains silver nitrate, and we touch the blood vessels, and it induces an inflammation. And by virtue of the inflammation, we can cause the vessels to shrink, and that stops the bleeding.
So you brought up inflammation. What causes a stuffy nose?
So a stuffy nose can be multifactorial. It can be a bent septum, which is the midline between right and left nostril. We can have a stuffy nose because there is actually something like an internal cycle where one nostril swells and stays swollen for 4 to 8 hours, and then the other side, and then it's the other side's turn. And we see it in pregnancy. So there's something like a hormonal stuffy nose. And then allergies. As the allergen hits the nose, it causes inflammation and makes everything swollen. And inside the nose is a tissue that's called terminate, which looks like an awning. And it can swell up and double in size, and that's how the nasal passage gets occluded, and then you get a stuffy nose. And for all those things, we can do things about.
Nasocort?
We can do Nasocort, which is great, yeah, right? It's a nasal steroid.
So is it bad to use these things every day? Like I know I've heard people ask me, or they'll say, oh, you don't want to spray that every day. Which ones can you use daily, and which ones?
So I think that rule, you shouldn't be taking a spray for more than a few days, probably applies more to Afrin. Afrin is a vasoconstrictant, which makes the blood vessels really, really tight. And we can use that safely for about 3 to 5 days. Afrin, yeah. That's oxymetazoline. And that's when you have a cold and you can't breathe and nothing is helping. That's a great spray. But you should limit it to that. You should limit that to about 5 days.
And then what about Flonase? That's a steroid, correct?
Perfectly safe to use. The ingredient is fluticasone, and it's available over the counter as well. And all the major drugstores actually carry that with their own brand.
So if you have a cold, is that...
You're right. If your nose is not too stuffy, it may help, but it may not be enough, and certainly not as potent as the Afrin. And it can be done safely for years. It's so safe that we can actually use it in pregnant women as well. So it's perfectly safe to do for years.
Yeah, I know. I use it. My wife and I use it just if we have sinus issues, or we always have one on hand, and if we're traveling, it gets put in our overnight bag.
Yeah.
It's fall, the weather's changing, people are getting colds, people are coming into the office with a hoarse cough, and they'll say, oh, it's the weather. How true is that? Can the weather actually affect your cough or your nasal passages, or is it just that you got a cold?
I think the weather changes can induce a bunch of things. They can stir up allergies, for instance. You may have some degree of allergies, for instance, and it makes you just a little bit more stuffy. And that with that, you might be breathing a bit more through your nose, through your mouth at night, and that gives you a sore throat and your upper airway, right? It's all connected. It's just responding a bit more, right? So let's say you have fall time and it gets a little colder outside,
like right
or
now.
a little moist, like a little bit more, it's more wet outside. You may have more fungus out there. So that's getting stirred up with all the wind that we've been having in the last few days. You're inhaling more of the mold more of the ragweed, and your nose, your upper airway is just responding differently. And so
it's not
that's
just
what
the
you're feeling.
pollens; it can be the fungus that's doing it.
Yeah, so for the allergies, we really like to think in seasons. For instance, in the spring, it's more the trees, and then in the summer, it's the grasses, and then in the fall, it's more the weeds. And so people are sometimes, more affected in one of the seasons, but we have many patients that have them all year round. And then there's indoor allergies like dust mites, cats and dogs that we need to think about. And so, some people are really troubled by all this.
So should we get our vents cleaned out? Does that help?
It certainly does. I think, having a good, clean environment at home helps. Things like cleaning the vent out, air purifier help, and these type of things. So on your
furnace, when you have a humidifier on the furnace, does that do anything to get more moisture, or does that make it worse?
Oh, well, you're talking to the right guy here. Things need to be moist, really. So
I just fixed mine, by the way. That's why I'm bringing this up.
Yeah, so there's a device called hygrometer, and that will measure the humidity inside your house. And I have actually one on every floor. And in my opinion, your humidity should be 40% or higher. Everything below will be really bad for your sinuses. And
so is this like a small device anyone can buy? Or
it's a tiny little device that you can buy on Amazon called hygrometer. And you
said on each floor because the humidity can change in different levels.
Right.
Of your
house. We live in a house here that has radiators. So we have to actually put up humidifiers. And we have them on every floor, and you should have them for sure in your bedroom, where you spend 6-8 hours every night, and that's gonna also help you with the breathing. A dry, warm air will make your nose stuffy. A more humid, cooler room will make your nose less stuffy. A drier room will make you more susceptible to get a cold because the mucous membranes start cracking. So there's all these things about it.
Do you use it year-round, or is it just certain seasons that you're using the humidifier?
Right. So in different locations here in the U.S., we have different climates. Up here in the Northeast, where we are, I think in the summer it's pretty humid out there, so there's really no concerns. But in the winter, especially once we start turning the heat on, you gotta put a humidifier out for sure.
Good. All right, let's talk about our ears now. I think the question that everyone wants to have an answer for: how loud can you play your AirPods or your headphones on your iPhone or Android, whatever you're listening to? How loud can we turn this music up before it causes irreversible ear damage?
So, interesting topic. Actually, my dad, he's an ENT too. He bought me, I had to fight to get my first Walkman. Remember the
Sony one? The yellow one?
The yellow one, yeah. And so he measured the loudness. He was an ENT too, and he put a line across the volume button. And so I could never go above, and he would spot check. That's how concerned he was. And I'm concerned too with my kids. The noise damage to your ears, that's very important for the listener, is irreversible. So if the damage that has been done, it's a cumulative damage, is the damage you're left with. And as a rule, 80 decibels for 40 hours per week are safe. Now, what is 80 decibels, right? We have no idea.
Right.
So that would be standing next to a vacuum. Being outside in a noisy street, that's 80 decibels. You and I talking is about 55 decibels. And every 10 decibels increase is double the amount of sound. So it's a logarithmic scale. And when we're out 85 decibels, it's no longer 40 hours a week. It's actually half of that. 90 decibels, it's 20 hours per week, etc. So the louder the sound is, the less long we can be exposed. For instance, a concert, 130 decibels. So there's some real issues. So you're not only going to have immediate hearing loss. So when you come, come home from the house,
your ears are ringing,
it's humming, it's buzzing. Ears will oftentimes, not always, recover. And there's also something we're concerned about, which is the tinnitus. That's a ringing sound. Well, if you're unlucky, this may stay for the rest of your life. So hearing is one of those things where we have to be very careful, especially with the younger kids.
So should we be wearing earplugs? Yeah, should we be wearing earplugs at concerts?
Yes, for sure.
The foam ones that you squeeze and stick.
100%. There's some great ones out there. They should filter about 30 decibels. That'll protect you, for sure.
So that's about 2 hours of loud music. So 130 decibels at 2 hours. Does that trigger anything for you when you hear that? Like, is that you're going to have some irreversible hearing loss?
You can. You don't. It's not super likely, but you can absolutely have permanent hearing loss.
So what about on your headphones? If you're on your device and you turn the volume up, is there something that's going to tell you how many decibels you're at?
You actually found out about this just the other day on my iPhone as I was going through the safety settings. There is actually a setting on my iPhone that I have turned on that doesn't allow me to go above 80 decibels. So it doesn't matter how often I hit the volume up button, it'll stop at 8 decibels. And that's something I take very seriously. And especially when I'm in a noisy environment, the tendency is to crank the volume up. And so that's why I'm a big fan of these noise cancellation headphones, which then allow me to listen to the music at a much lower volume.
So those are actually helping you? They're not just creating another frequency of sound so that you can hear the music? They're actually safe to use?
Yeah, so they're essentially emitting a frequency that kills the incoming sound. So what's then being projected into your ear is at a much lower sound level. So it's not that they're cumulative and that somehow, fooling your brain. It's actually
it's like
real.
Bouncing away the louder sounds that are coming in.
So to say, it's kind of it's leveling it out essentially.
So if I'm on an airplane and it's extremely loud on there, and I put my noise canceling headphones on, and I don't play any music, but I can't hear, it's actually helping me.
Yes.
Interesting.
Yeah, I'm a big fan of those. For airplanes, it's perfect, right? On airplanes, it's probably around 70 decibels. It's pretty loud.
It is loud, yeah.
Right? And so if you do a transatlantic flight for 8 or 9 hours, it's kind of annoying. And so these noise cancellation headphones are, I think, really a game changer. It's not just a lot more pleasant, but you can actually sleep and relax, can listen to music, and not be bothered by any of the sound.
And you don't have to turn it up louder, right? You can keep it at a normal volume.
That's a point. One of the questions I sometimes get asked is, what about ears, earwax?
Yeah.
And what do we do about cleaning the ears?
Oh, yeah, Q-tips. Are Q-tips safe?
Yeah, so what's up with the wax? Why do we have wax, right? So that's actually the ear canal is actually a dead end, right? There's nothing that you can do to kind of get it out. And so the wax, it's a blind pocket. The wax actually has a protective film. It's a little acidic. It's sour. It kills bacteria. The skin inside the ear canal is super thin, and it protects and lubricates the skin. Okay? You can't put any lotion in it. And then there's tiny little hair on the inside of the canal skin that will kind of move the wax slowly out, so that technically you would never have to clean your ears because it's doing it itself. And so the wax ends up right here on the outside of the ear, where we just wipe it off with a towel or the Q-tip. So with the Q-tip, we stay far out and we never put it in like a plunger into a barrel. Because we shove everything down into the hole and we destroy the little hair, so they can't work well. Now, in some people, they have a different type of wax composition, and that self-cleaning mechanism doesn't really work well. So those individuals either come and see me and we clean the ears. There are some other tools that you can buy on Amazon and whatnot, cleaning
Do you recommend
irrigators.
That's your hearing. I would be afraid to try that.
Yeah, so I think some of the things are good and some of the things are bad, just like with everything. So you shouldn't apply an enormous amount of pressure directly onto the ear canal or inside, because it could hit the eardrum and could rupture it.
What about hydrogen peroxide? I've heard you can use that.
Yeah, I'm actually a bigger fan of things such as Deprox. That works well. The hydrogen peroxide works well in some instances, but the problem is it makes the skin so dry, so it really disrupts things. So I wouldn't really advise that. One of the questions I get asked oftentimes is, what about those ear candles?
I've never seen those.
Yeah, so this is something I get asked, which is the biggest bogus I've probably heard, which is, again, a candle is it's a string and some wax around it. So the idea is they put that wick into the ear and then they light it up, and then it pulls the wax, like a candle wax, out. Obviously, that doesn't work. And I've seen people doing a lot of damage because then the wick burns and the burn transfers right into the ear and causes a burn inside, and they can be serious. So
do you see these people from the emergency room, or do they just come in saying, I stuck a candle in my ear?
All of the above. All of the above. So that's really something that I would advise everyone to not even look into or consider any further. So again, for the ear, the Deprox drops are good, and otherwise Q-tips just on the outside, and otherwise the ear should be pretty much on autopilot. It cleans itself.
What about swimmer's ear?
Yeah, swimmer's ear is typically caused by dirty pool water. Somebody, let's say, was mucking around with the Q-tips inside the ear canal, caused a little bit of damage, and then the dirty bacteria-filled water goes inside, sits for a minute or half an hour inside the canal, and the bacteria travel through the thin skin that was previously damaged from the Q-tip, and now you have an infection. It was extremely painful, very painful.
Here's a question. Sometimes when I'm swimming and I come out of the water and I can feel that water in my ear, I'm doing one of these to try to get it out.
Right.
What happens if I don't get it out? Is that bad? Should I keep trying to break my neck until it comes out, or do I just let it run its course?
Yeah. Have your son put you upside down and then come out. So it'll always come out. There's some air that goes in. You could use a hair dryer. Some of my patients have chronic ear infections, like an eczema, and they use an hair dryer successfully. So those are some of the things you could consider.
I know what we didn't talk about: tonsils. Why do some people have to get their tonsils taken out? Is it safe? Do you recommend it? When do you have to have your tonsils removed?
Yeah, so we, back in the days, I don't know, I lost my tonsils when I was 7, and I asked my dad, who actually took them out, like, why did you ever take them out? And
for vacation, right?
No, what he said, well, everybody gets them out, so you got yours out too. I said, no, I don't understand. Why did I get them out? And he said, you just needed them out. Nowadays, that has changed. We leave tonsils in unless they cause problems. And so a good rule of thumb is when you have about 5 infections a year, 3 for 2 consecutive years, we take them out. That's a rough rule, which can be changed. Ultimately, kids tend to have more infections, more strep throats. Too many strep throats, we take them out. In adults, strep throats are really not as much of an issue, but we take them out, sometimes for snoring. Or if you have some infections and you miss work too often, you can't be on antibiotics all the time, then we have a discussion around taking them out.
And what are the tonsils for? Why do we have them?
They don't really, so they're lymphatic tissue. Lymphatic tissue is tissue that is part of our immune system.
So is it a lymph node, or is it like a lymph node?
It's like a big lymph node, to be honest. But it doesn't really help us that much. It causes more issues than it helps us. Here in the head and neck area, we have a little more than 200 lymph nodes. So we have plenty of other filters, plenty of other systems in place that fight infections. We don't need tonsils. They cause more issues than not.
What about those pearls that they get on the tonsils? Is that what they're called? Or they're...
You're probably referring to tonsil stones.
Yes.
Yes. So the tonsil stones are, the tonsil is a big, it's a piece of tissue that has large pockets in them. And those pockets trap bacteria and debris. And the debris stays in for a long time and becomes from a smeary white material, it turns into a stone. And that stone can be hard, can be poking, and can be causing pain, microinfections, bad taste, and bad breath. And people try water picks and gargles. It doesn't really help much. And ultimately, in my opinion, only removing tonsils will put an end to this.
Can you just take the stone out in the office?
Yes, you can take it out, but it usually comes back. That's a problem.
Really?
The underlying issue is that the tonsil has big holes and pockets in them. And so oftentimes they don't go away and they keep on coming back.
Can you get them out in the office, or do you have to take them into the operating room?
No, so I've taken them out, but patients take them out actually, and people will push the fingers back on the tonsil and squeeze it out, and they bring those into the office.
In a Ziploc bag, huh?
And then I said, I've seen it plenty of times. You don't need to show me. Yeah, same thing. People bring me bookers in sometimes.
They bring me toenails.
Yeah. I said,
never a toe. They sometimes go home with a toe, but
Yeah.
I've never had to bring
And so I can squeeze them with a tongue blade or so, but ultimately they keep on coming back. And so most patients who see me for tonsil stones see me because they kind of tried everything, and now we're talking about removing the tonsils.
So you said you're from Germany. I'm a big U2 fan. What does Achtung, I don't even know if I'm saying it right, what does Achtung baby mean?
Achtung baby means attention baby.
Interesting.
Yeah.
That was the name of one of their albums, right?
Yeah. From U2?
Yes.
But they're not German.
No, they're Irish.
Yeah.
I always thought it was an Irish term, but my wife told me it was German.
German, yeah.
She actually looked it up before I came here, and she wouldn't tell me what it meant because I wanted to ask you. So
Yeah.
what does it mean?
It means attention.
Attention.
Yeah. Yeah, pay attention.
Maybe that's what we should name this. We'll name our podcast. No.
Achtung. That's a dad being a little nerdy.
Well, this was great, Dr. Mark. He has a YouTube channel as well. If you want to ask us any questions, drop it in the comment section below. We'll put Dr. Mark's link up there if you want to head over to his YouTube channel. Anything else you'd like to share with us today before we leave?
No, I'm all excited. Thanks for having me on your channel. If you want to go to my website, voiceandsleep.com, and I appreciate it.
Sure. Thanks. This was great.
Thanks, man.